Welcome back to Rural Health Today. This episode is another installment in our season on maternal care and rural health, where we're talking with maternal health experts about rural maternal morbidity, genetics, mental health, and more to understand the barriers to proper maternal health care in rural America. Welcome. Today, our guest is Dr. Melissa Bauer, anesthesiologist at Duke University's Hospital Birthing Center and former chair, where she spent a lot of her time discussing issues that are important to maternal health. She served as the chair of the National Alliance for Innovation on Maternal Health, Sepsis, and her work has brought her to our studio today because we've had a chance to study some of the work that has been produced, and she is making some significant achievements in the area of maternal health that we really just wanted to bring to our national listeners today. So first of all, Dr. Bauer, this is your first introduction to Rural Health, a podcast today, and it is exciting to have you here. So I want to welcome you first. And then second of all, because our audience is across the country, they don't know who you are. I would just like an opportunity for you to share a little bit about yourself, your background, the work that you do, and what you're excited about as you move forward in promoting maternal health.
Yes, thank you so much for the honor to be here today. My name is Melissa Bauer. I am an associate professor at Duke University, and I'm an anesthesiologist with fellowship training in both critical care as well as obstetric anesthesiology. And my research is focused on maternal sepsis and improving early identification and treatment. Throughout that work, I've received NIH funding that we are using to implement sepsis safety practices across the entire state of Michigan. And I'm working with a colleague who is also implementing across the state of California. So we're doing a lot of work and listening to patients and also doing community and patient engaged work to improve outcomes for maternal sepsis.
That's amazing. And the work you're doing is incredible. It's mission minded, that's for sure. Dr. Bauer, I just have a question. You know, when you decided that you wanted to get in, anesthesiology, one doesn't wake up in the middle of the night and say, I think I want to do that. There had to be a passion or a purpose that drove you to making that decision. Do you mind sharing with our listeners what led you to this career pathway?
Yeah, I think that one reason why I thought that it was a great field to choose is because we get to be with patients at a time that they're pretty nervous and concerned about whatever procedure they may be having, and we can be a great comfort to them during that time. And also my job is to keep people safe and comfortable. And I use that every single day to make sure that people feel comfortable as they're getting ready to have something that might be their first procedure they've ever had, could be something life-changing for them, having a major surgery, and there to just make sure that they get through things safely. And then I chose going into my research into maternal sepsis because there are just so many differences in maternal sepsis compared to the general population. And I really wanted to make sure that patients knew about the differences so that they could seek care, as well as to help providers identify care so they can get early treatment that actually improves outcomes.
Absolutely. Well, first and foremost, we love our anesthesiologist in rural America, and y'all are in high demand. And then you pair that with someone who has not only just a clinical acumen, but also a business acumen and a research acumen. This is like the jackpot for us on this podcast. So I'm excited to have a conversation with you today. But for our listeners across the country who don't know who you are or have just heard a little bit about your background, is there any fun fact that would characterize you, something interesting that would relate to our listeners that you'd like to share with us about maybe your background, your work you've done? Maybe it's something special to you that you'd like to share with our listeners?
Oh, sure. A couple of things is that I'm a yoga teacher in addition to being a physician,
okay,
which is something that I really enjoy. And also I do a lot of prenatal yoga because I think it really does matter to improve your wellness throughout pregnancy. And I'm a huge animal lover. And also, I was born and raised in Michigan my entire life. I really only left there 5 years ago to go to Duke. So Michigan's always home to me.
Well, we love Michigan, don't we? What part of Michigan do you mind sharing?
Southeastern Michigan.
So yeah. So beautiful land, in Michigan, plenty of lakes and beautiful places up north. We're very fond of Michigan. So hopefully we can get you back to Michigan here in the future. But I understand the work that has taken you there is so important. And we're going to talk a little bit about that today. So today we're talking about maternal health sepsis and barriers to sepsis care. Dr. Melissa Bauer is here to share her perspective and insight as a birthing center anesthesiologist and leader in maternal health sepsis prevention. We'll talk about diagnosing sepsis and serious maternal health conditions, equipping patients with the education that they desperately need, and of course, what does all of this have to do with rural health? So let's jump into some of our discussion points today. What factors put patients at the greatest risk for maternal sepsis? For example, we talk about genetics, lifestyle. Is it geographic? Can you maybe help our listeners understand a little bit more about those risk factors? And then a secondary question to that is, how can healthcare providers and patients work together to mitigate these high risk?
Yeah, thank you for that question. I want to start by just highlighting a couple things about sepsis, because I think it's not a very common term. And I think, it's important to understand exactly what we mean by that, and that sepsis is really a life-threatening response to an infection that includes end organ injury. So having some organ failure and type of thing associated with infection, just for those that may not know what that means. And there's a number of factors that would increase someone's risk of having sepsis. A lot of that might have to do with having any risk for infection. So having an existing infection that's not treated, or patients who may have some immunocompromised conditions that might lead to increased infections. And certainly during pregnancy, there are some risk factors that might predispose someone to having an infection, and then they have that response to it. But what we found in our research a number of years ago that I think is really important is that when we looked at it for pregnant and postpartum patients, what we found was that all patients were at risk, and that most cases actually occurred in patients with no risk factors. So I think that it's important in certain conditions that let's focus on those at risk. Let's make sure to educate them about everything. But I think really it's important for sepsis that it is a rare condition, but that many patients who have no risk factors might end up having it. And so I think it's best to educate everyone, all patients as well as providers, to even look at patients they might not seem at risk.
Yeah, Dr. Bauer, it's a significant amount of work. You've identified some of those risk factors, and very interesting to hear that, in some of those situations that, they were not initially screened as at risk. But when you're meeting with rural providers, how do you bridge some of those gaps in talking with them about communicating with their patients? And I know I'm going a little off script here, but I really just want to kind of hone in on, as the providers that are listening to this podcast today, what educational steps can they take? How do we engage with that population and have those discussions?
So I think one of the best tools is to educate patients about the warning signs. Most cases happen outside the hospital. So they occur postpartum as well as antepartum, before patients even arrive for delivery. Right. And the longer that someone may be experiencing symptoms and not getting care, the bigger risk it is to them in how sick they may get and have prolonged injury or maybe even survival. So one of the resources that I think is the most important is supported by the Alliance for Innovation on Maternal Health, and it's called the Urgent Maternal Warning Signs. Okay. And it's free for anyone to use. It's on saferbirth.org. And it's been translated into 80 languages. And it's a set of symptoms that patients may experience during pregnancy or postpartum that would indicate that they may have sepsis or another type of severe maternal morbidity. And so having awareness of those symptoms is really key, because if you think about it, for public health reasons, everyone seems to be aware of the signs and symptoms of having a heart attack or stroke. but people aren't really aware of these warning signs that can be really critical. And so we want to make sure that everyone's aware, not just pregnant patients, but everyone around them, because people tend to go to their friends and family when they have something going on. They don't really seek medical care. So we want to make sure that we educate the entire community about what these warning signs might be. And so really equipping your patients with those tools and a way to reach out if they're experiencing them so you can evaluate them, I think is really critical.
Yeah, Dr. Bauer, that's a great understanding of education and evaluation. I want to hone in on just a little bit regarding community education. So this is something, very important to me as we're engaged in this series, and I'm learning so much about maternal health. And in this particular area, we want to hone in on the sepsis part of it. But we say community education. What types of programs exist for communities like hospitals, for example, and or health departments? What programs exist for them to help educate the community and the patient? Is there a national website? Is there, are there certain podcast materials? What is it that is available?
Well, the state of Michigan is amazing in that they have regional perinatal quality collaboratives, and those are supported by the state that are actually community leaders that are working to improve maternal and infant health. And you can go on the website and identify who your contact is in each region of the state. There are, I think, there's 9 or 10 regions, and they each have a group of people that are working with hospitals to improve care. And we are actually working to connect them with each other, because hospitals always want to have connections with the community so that they can give the best care. And so that is a really great way to get involved with your communities and share with them whatever topic that you're interested in, but also having them share with you what their challenges are so that you can improve care. And so that's a great way. We also have partnered with the implementation across the state. We partnered with multiple health departments. We also partnered with community-based organizations so that they can distribute materials. We also have partnered with WIC. And also houses of worship are really important. People get a lot of their health information from their churches.
They sure do.
So what we have done, which I can share with you, is we created kind of a size of a credit card that has a QR code that has information about the warning signs, as well as ways for them to advocate for themselves if they're not feeling heard, as well as some other resources that are available. We know that you can't really have health if you don't have your basic needs. And there's a lot of food insecurity in the state of Michigan. And we released a food insecurity resource tool on that QR code. And so we update that very frequently as well, that has resources that were created by our community leaders that we all put together. And so I think that really working side by side with people, with your community leaders, as well as health departments and houses of worship and things like that, I think are really important.
That's a great idea. And we're going to place in our show notes some of those available resources, because I think it's very important to give that access to our community so that they do have an understanding that there is some help available. And when we speak about help that's available, it's one thing to have a resource guide and a material, but if there's tangible resources that one can hold on to, would they find those resources at their OBGYN office? If, in other words, how do they advocate for themselves? How does a patient advocate for themselves when they suspect that potentially, they do have or at risk of sepsis? Where is that? I mean, they can look at a guide. I understand that's important, but more of that ability to speak with someone and to be able to have that conversation requires patient advocacy. And much of that is how do they advocate for themselves?
Mm-hmm. So I think it's a partnership in that I just want to be clear about the guide that we provided. That was created by patients themselves as well as community leaders on how they can express that, maybe when they're expressing something, that they're kind of saying, oh, well, that's normal. That's normal. Don't worry about it. And they're feeling like, no, actually, I really don't feel like this is normal for me and I really need help. It actually gives them words to say, because when we interviewed patients that this occurred to, they said that they knew they needed to advocate, but they didn't really know how to, they didn't know what to say, because even me, I'm a physician. Sometimes I feel like I don't know what to say when when I'm trying to get something that I might feel like I need, because it's just a weird position to be in. Feeling as a patient, I feel like there's just such a big power differential that it can be really challenging. And so we created this together about what to say and also what to do if you're not feeling heard. I mean, we even put things in there like bring someone with you to help advocate for you, bring a doula, bring a friend, bring a family member, and also that you can seek care even if you don't have. Some people didn't seek care because they thought they needed permission before doing so. And so we're saying, no, actually go to the ER, go to triage if you're really feeling unwell. The challenge with maternal sepsis is that I don't believe that these things that happen are intentional. I believe that there are a lot of nonspecific symptoms that occur when people start experiencing that. And 99% of the time, people are fine. They don't have maternal sepsis. They don't have something serious going on. And I think some people are just trying to reassure them. But we need to ask more questions and really hear what that person is experiencing. So, for example, a patient may say, I feel really tired. Well, that's really common for postpartum, but what's not normal is if they're not able to do their activities of daily living, such as they are not able to climb up the stairs without significant fatigue and stopping. They're not able to brush their teeth. They're not able to care for the newborn. Those things would warrant an evaluation, because that's a really concerning sign that that person is not able to care for themselves or their newborn. But we need to ask questions to get there. So it's a partnership in that we've provided patients these tools, not because we're saying that they have to advocate for themselves to get the care that they need. That's not their responsibility. We just know that there are some challenges that we're all working on and listening to patients better. And so giving them those tools is important, but also taking a look at ourselves and making sure that we're not cutting people off and that we're listening and asking really good questions so they can express exactly what they're feeling so they can get the evaluation and care that they need.
Yeah, it's incredible. Dr. Bauer, what would you, if you were to identify steps, so let's just say we can safely identify that the patient has sepsis. Okay. What are the remediation steps that happen next for patients, and where do they get those resources?
So I just want to make sure I understand the question. This is someone who they've experienced sepsis and
yes.
They have recovered and now they're moving forward. Okay. So we also included some really great materials on the website that were also created by a number of experts. So patients, community members, as well as birth trauma therapists and physicians and nurses. And this set of resources really helps the clinician team to meet with the patient, explain to them every single thing that happened, what things they need to look out for in the future. And then also it gives a lot of, it has 4 pieces to it. The first piece is guiding through that. We call it a patient debrief, but it's really a patient care discussion where we tell them everything that happened, what things to look out for, what they might expect in their recovery. There's also a second document that I think is really important, and it's about what not to say. And we are learning more and more about the trauma that people experience with birth trauma, and by birth trauma, just something that was traumatic that happened to the patient, whether they had to have a stat C-section that was really scary for them, or they had a major complication. And we're learning more and more about that. And so we worked with the trauma experts, and they created this document with patients as well that said what not to say, because there are several things that well-meaning people can say that can further traumatize people. And I think it's an incredible resource. There's also a document that is given to the patient before the care discussion so that they can see what to expect, because it's really hard to go into something like that as a patient and not know what's going to happen. What are they going to tell me? What kind of questions can I ask? And it really preps them for that conversation so they can invite whoever they would like to be there, or maybe there's someone they don't want to be there that was part of their care team, that they can also express that. Additionally, the last is a checklist. So these patients get the follow-up care that they need. Unfortunately, there are some long-term conditions that can happen after sepsis that are not small. And it's similar to something like long COVID, where some people experience some long-term symptoms. Same thing with sepsis. And we want to make sure that they get the help that they need. They might need physical therapy or occupational therapy, or if they have trouble swallowing, they might need speech therapy for that, but also making sure to screen them for depression, anxiety, and post-traumatic stress disorder, which can happen at regular intervals throughout that first year postpartum, but really just making sure that we're giving them everything they need so that they can get the follow-up care that they need, so that they can really make it through their recovery and become even healthier after that.
Yeah, phenomenal. It really comes down to advocacy at every level. It's hospitals advocating, it's OBGYNs advocating, it's individuals in community settings, it's church, it's ministers, everyone's advocating. And it's access. We often find in rural America that access is our biggest problem, because the lack thereof. And so one thing Michigan has done, and we had the pleasure of speaking with someone from the Michigan Department of Health and Human Services, is that, Michigan has a program where they cover now and provide for doulas. Post discharge of a patient, they are, the doula can come in with them, but you do get a doula, and that doula is provided by the state of Michigan. That's an incredible service to have, because prior to that, many patients, I should say, were left to their own, and we're trying to figure all of this out. I mean, I would assume that you're very supportive of the model of doula as it relates to empowering and educating our moms on, what signs and symptoms, should they be looking for, not only with, as we talk about sepsis, but to your point, depression, anxiety, known factors from a previous delivery, such as they went through a traumatic experience. They had to go into a stat C-section, or for whatever reason, there were complications just with the provider, and maybe it's even an anesthesia issue, right? And so they couldn't get in time to give the epidural, whatever it is that causes the birth plan to be interrupted, is a traumatic experience. And in my own family, we have experienced that with a loved one of mine recently on two separate occasions in her two only births, both of them having complications that resulted in conversations such as, I'm never doing this again. I'm never going to go through this. Even though they want additional children, there's that fear. And to your point, there is a tremendous amount of resources that are available to walk them through that postpartum depression or postpartum experience that they had that was during the traumatic experience of their delivery. And I just think it's so important that we as administrators, as hospitals, as clinicians, advocate, and that we can do that through various programs. And specifically in Michigan, our listeners today, if you're listening in Michigan, you can go to the Michigan Department of Health and Human Services, and you can learn more about the doula services that are available to you and your family at no charge. There's actually coverage for that. And I think that's an powerful opportunity for our patients. And so I don't even necessarily, that's not part of our script today, but I think it's important to highlight. And Dr. Bauer, I know you probably have extensive experience working with this doula program and or, the postpartum depression. Any comments about that, about those type of services that are available in communities?
I think it's a really important service, and I really value my doula partners, and we did work with them to share those warning signs with the clients that they work with. And I think that it's really helpful to just have someone there to help explain things to you if people aren't explaining things in the best way, but also help advocate for you to say, we're really concerned about this. Can you please walk us through this and tell us what your thoughts are about this? And to advocate for whatever that may be. I think it's really important, especially for postpartum and someone's experiencing something, to have someone there to help say, I think we're trying to get answers about what she's experiencing and we're just really concerned. It's helpful to have someone outside of yourself help advocate. And I really value the doulas that we work with.
Yeah, the message we want our community to hear, and I think communities across the country on this podcast, is that moms are not alone. The partner goes back to work, right? After, and oftentimes that period of time can be very stressful for the mom, and especially if there was a traumatic experience that has not been addressed. And I think the key is, if you're listening today and you're a family member of a patient who has experienced some trauma in the delivery room, or even leading up to it, or even after it, you have to advocate. You should advocate for the safety and welfare of the mother and the child. And I think that is so important that we lift our voices in advocacy. In our last question, Dr. Bauer, there are so many barriers in rural health. There is transportation barriers, to get patients where they need to. There's barriers if you look social economically, communities in rural communities, the majority of our patients are Medicaid that are in our OB service, right? And we're often challenged with the challenge of not having access for transportation for those patients to even make it to their appointments, which causes significant concern for the health and wellness of both mom and baby. And then there's other challenges, and this is across the country. It's not just specific to rural, but food insecurities. My goodness, we have, I think 14 food pantries in Hillsdale County, and every one of them are active and busy. And there are definite needs for moms with nutritional needs, and we need to address those as well, because we can throw as much resources and brochures and literature at patients, but if we're not meeting their basic necessities, food, clothing, environment, we're failing, because that brochure means absolutely nothing. And so there are barriers, Dr. Bauer, and I guess you above any of us have experienced those, because you have watched them from your review and research, and as well as from your practice. You've had a chance to see barriers. And I guess the last question I'm going to ask is, knowing what those barriers are, maybe you can just share some of the barriers that you've experienced, in your practice, and what you've experienced as you've been doing some of this research. And then what would be your vision for hospitals working with patients to remove those barriers and to ensure that every mother gets the care they desperately need?
Yes, thank you for that. And I think this is a really, really important question. Throughout our work across the state, one thing that I learned, and we're all learning, so it's something that was new to me, was that the internet connectivity can be really spotty in rural areas. Yes. And many people don't have access to internet. There was a federal program that was helpful in reducing that cost that has been removed. And so a lot of people don't have internet access, or if they do, sometimes it's spotty and it doesn't work very well. So I think that it's really important to give people resources that they can have 24/7. I always advocate for electronic resources because people were so dependent on our phones. But I think that it's really key in rural areas to provide both, and to give them some resources that are not just a stack of papers, just to be really, really intentional about what you give to people. So I would print out the warning signs in their language, and I would print out the advocacy language and actions. We have those in Spanish and Arabic and English on the website, as well as the food and security resource tools also in those languages on the website. And I think that printing those things out is also key. So when someone doesn't have access, that they still have access to those important tools. But whatever else you think is important for them should also be given. One of the other barriers that we experienced with hospitals is that IT support is not very plentiful in rural hospitals because there's a large cost to it. You can't get a lot of people that want to do IT support in some rural areas. And so we struggled with one of the initiatives we had done with the sepsis initiative was to create an order set, because time is really critical when someone's sick, and that you don't want to delay antibiotics. And so we wanted to create an order set so you could just click through it and give exactly what the patient needs without looking things up. And many of our rural hospitals talked to us and told us that they didn't really have the IT support to get an order set put in. And so we worked with them.
Isn't that amazing?
Yeah, it's really unfortunate. And so
it is unfortunate. In today's time, it's unfortunate.
It is. And so we worked with them to create a mock order set that they laminated to carry in their binder, so that when they have a patient who's sick, that if they didn't get the IT support to put in the order set, they could mock putting in the orders exactly as written there, so they don't have to look things up. They have it right at their fingertips, and we don't delay that critical time period. And then also, we also heard from hospitals that many times they have to rely on locums care for some of their providers because they don't have the staffing for that, and that they're not as familiar with their protocols. So what we suggested, and the nurses gave great suggestions, we all kind of came up with this together, is that for certain conditions, what they were doing, and one of the nurses told me about her process of doing it, which we suggested for sepsis as well, is they have the plans for what they're supposed to do, what is ideal with their medical director. And so they would do scripting where they would say, well, this is occurring. Do you want to do this or that? Rather than just leave it up to someone to decide who's not familiar with their processes, in a non-threatening way, but in a way of just, making sure that they're aware, but also just having those resources available at all times. We have a flow chart that we give hospitals to follow about screening and then diagnosis and treatment. And so they have that with them so that they can share it and be able to help guide that person who's unfamiliar with the process at that hospital into what the medical direction, the medical director and all the leaders of that hospital have determined how they would like the protocolization of that care.
Wow, those are important tools. And the great news is that they're available to our community hospitals, to our provider offices. And I would just encourage our listeners, if you're a provider, if you're a hospital executive, a nursing leader, please look at the show notes. There are resources available. Dr. Bauer, I do have a question. If someone is interested in programs that can be brought to community hospitals for, let's just say, a presentation on these issues, are there resources available for in-person presentations? Like, is that usually coordinated through each state's health departments? Because, we have individuals that are listening across the country. It's not just Michigan, but I know we have experience in Michigan. But for other communities, if a hospital executive says, how do I address this today? Is there a hour seminar we can host? What resources are available, if any, for that type of engagement?
Yeah, that's a great question. What I would suggest is reaching out for maternal health. I would reach out to your state Alliance for Innovation on Maternal Health. So Michigan has an incredible organization. They have a website that you'll see as part of the show notes. And you can reach out to them, and I'm sure that they can connect you with someone who would be available to speak. A lot of times things are virtually. I know people are pretty busy, but having someone to address things, I think, is really key.
Yeah. In order to empower our patients, we have to have the knowledge and the resources as leaders and as clinicians to be able to provide that to our patient. And so I would encourage you today, if you're listening, there are resources available. There's opportunities for you to learn more about these issues in our series of maternal health. We would encourage you to look at the show notes and then to reach out to us. I'm sure we'll even be able to place Dr. Bauer's contact information up on the screen, and individuals, if they're interested, can reach out to learn about what you can do to help in your respective state. We're so excited that you're, representing the great state of Michigan, but that you're doing this across the country, because when you lift your voice up, Dr. Bauer, it's not just for Michiganders. It's the research that you're doing that's going to improve the lives across the country. So first, I want to thank you for the work that you're doing, because it is very noble. It is very mission-minded. So I want to thank you for that. Second of all, I want to thank you for joining us today on this podcast. It's very important to get messages like these out to our communities across the country, and that there are resources available. If you're listening today and you're a mom, there are resources. It's not just available for hospitals to teach and to have access to those. It also empowers you. It empowers you to also find opportunities through doula programs and other services where, if you're not necessarily, let's just say, strong on advocacy for yourself, someone can advocate for you. You can bring a care provider along to appointments. You have a right to do that. And we want to empower you as our listener that you do have available resources, even if you can't afford those. They will be provided for you. So please check out our show notes. There's plenty of resources in your respective states. Contact your, health departments. There's resources that start locally there. And your Department of Health in each of those respective counties can contact other resources in the states that you are calling from. And there are opportunities for you and your family. And there's opportunities for you for advocacy as well as for care, post-delivery, pre-delivery, whatever it is, whatever your needs are. We want to be here to service you and your family. So once again, Dr. Bauer, thank you for joining us today. It's great to have you on the program. And we like to close with one of our segments. We call it Rural Health Recommendations. You're a great leader. You're a clinician. You are a researcher. You're a writer. And so you have a lot of experience in many areas. And for every guest that we have on our podcast, we really just like to tap into their wealth of knowledge and to their understanding of the industries. And we have young leaders that are listening to this podcast. In fact, one hospital in Michigan up north, they have their leadership team listen to the podcast once a week. And we decided from that, we need to provide some meat and substance beyond just the program. And part of that was coming up with rural health recommendations. So as we close today, could you provide a tip, a recommendation for someone who maybe is new working in rural healthcare, the challenges of rural healthcare, or maybe some sage advice on thriving in a rural setting? And then we add that recommendation to our outline guide, and it will be available on our website at ruralhealthtoday.com. So I'm going to ask you specifically, Dr. Bauer, what is your rural health recommendation?
Thank you for that. I mentioned it earlier, but I just want to say again, to make sure that patients, that you don't make assumptions about what they have available to them, whether that's transportation, whether that is access to the internet, but giving them what they need. So asking them, ask them specifically, do you have access to the internet? Can I give you these resources? How can I give you these resources in a way that you'll be able to use them is really key. And so giving them paper documents or a magnet with the warning signs on it, something like that, so that they have access to it at all times, I think is really key. But I think the biggest part, which I think is important for all patients, but especially in rural areas, asking patients what they need and taking the time to ask about social drivers of health, such as, housing, food, all the resources that they might need. I think that it's really important that we find out what they're experiencing so that we can get them the resources that they need.
Fantastic recommendation. Once again, Dr. Bauer, thanks for joining us today. It's been great to have you on the program. I look forward to maybe a future update about some of the work that you're doing. And certainly we just want to say thank you for lifting your voice. When you lift your voice, you're lifting all of our voices in rural America. And the work that you're doing is so, so important. So thank you for joining us today.
Thank you for having me.
And thank you to our listeners for tuning into Rural Health Today. Catch our next segment, Rural Health News, to stay up to date on the current state of rural health every Monday, wherever you get your podcast. Don't forget to check out the latest updates and resources from Rural Health Today at ruralhealthtoday.com. ruralhealthtoday.com. And make sure you've subscribed to the show so you never miss an episode. Until next time, remember the power of rule.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to our guests for sharing their expertise on the show, and also to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.